You are watching the Doctalk show.
In our future story today,
so basically what we are doing, we are going to start preparing the donor area. We are going to get skin from here. This is where the cells are that secrete the melanin. So we are going to extract them from the thigh using a machine called a micrograft punch, and we are going to remove them really tiny pieces, and then later we shall move them and transplant them in the area where there's a vitiligo, where I want to cover and bring back color. So what we are looking at now, what we are doing, we are preparing the site, the recipient site where the vitiligo is, and we are doing the punches. We are removing the cells that have the vitiligo. So we are punching them out basically in small bits. So we are creating like holes where we are going to implant the new skin from the donor site that has the melanocytes, that has the color. So that's what we are doing there. So right here what we are looking at is this is how the donor area looks like after we've extracted. Those small tiny holes you see are where the skin that had the color was. So we are still extracting. You can actually still see the extraction process ongoing. So I'm removing the pieces. They're really tiny, one by one, and we are putting them in a special liquid that keeps them alive basically until we are transplanting. Now you can see there we're implanting at the same time. So we are putting them in the area that had the cells with the vitiligo removed. So we are putting them in one by one. I think you can see that. Yeah. So she's removing. So what we are seeing now happening, we are removing the skin from the donor area, one piece at a time. The small pieces we talked about, that's why we call it micrografting. And we are removing them, putting them in a preservative before we transplant them and put them in the recipient area on the hands. So they're really delicate, so it's a delicate procedure. We remove one piece at a time so that we put it in the preservative before we transplant it to the area where it's supposed to go. So we extract them after punching them out.
My name is Joel Magola, father to Joel Magola. She has a condition called vitiligo, which is a discoloring of her skin. She has been having this for the last 12 years. She was born when she was okay. Her skin was fine. And then at the age of around 4 years, we started to notice that the melamine in her skin, especially around the eyes, was going. So we tried many doctors, skin specialists, who gave us some medications, some creams to use. And in the journey that we have had for the last 8 years, we have used many things, even traditional herbs and what. But generally, vitiligo is a skin condition that does not go away, and it keeps growing. So it started small as small spots, and then they kept growing onto the arms, onto the face, onto the legs, and until when we came to Unity Skin Clinic last year and met Dr. Malik, who started to advise us on a new method for treating the condition. She's our firstborn. Our followers are okay. They don't have it. We are told it's a blood condition. It comes within the bloodline. And we have seen one of the uncles, who is a grandfather to her, have it. We agreed to the treatment that is being done to her. For any girl, they care about how they look. And you know, I just want to thank God for my daughter, because she's very confident. She wanted to stay that way. She felt like she was unique. At first, when she went to the first schools where she went, she would be treated unfairly, bullied. But eventually she got over it. She got on top of it, and she started to live confidently, and that reduced the pressure on us as her parents. So trying to get the treatment was one of the motivations, if we can get her to live a normal life. My message to the public is there is always hope in anything. It doesn't matter, because when we started to treat the vitiligo, because the first treatments we tried, some of them were using steroids, which are aggressive against the skin. So the treatment that we are using now is good for the skin. There are no side effects, known side effects. So there's hope. You can get treatment. Your skin can come back to normal. We have seen progressively that our daughter, the color of her skin is changing.
You are watching the Doctalk Show.
So, Doctor, do you have any maybe final remarks, those final tips as we conclude?
Yeah.
Yes.
Try to have a positive attitude. If you have stress, find ways of managing the stress. Seek help from a counselor, because the stress will make your condition worse. Don't listen to what other people are telling you. The disease is not the end of the world. It's not a life sentence. It will not kill you. It's not a cancer. It's something you can live with. You can have a healthy, normal life. So you should not worry so much about it, because the more you worry, the more it spreads. Okay? And to the relatives, the in-laws, the family, the teachers, the students at school, the friends, we should not ostracize patients who have vitiligo. There's nothing wrong with them. There's no stigma. We don't have to have stigma against these patients who have vitiligo. They are perfectly normal. You can give them a handshake. Those in marriage, there's no problem if they have the vitiligo. So please do not ostracize the society. It's not about myths or cultural beliefs, but something that is treatable. If it's not treatable, it's something that you can learn to support the poor vitiligo to live with.
All right, well said, Doctor. So you have options. You can either treat it with the surgery, or can choose to live with it, and you still live your life as happily ever after. So thank you very much, Dr. Malik from Unity Skin Clinic, and hope you've enjoyed the show. We shall see you next time on the Doctalk Show. Send in your questions and comments on our social media platforms. We'll be so happy to hear from you and to answer each and every one of them. Till next time, goodbye.
The Doctalk Show.